Hello, friends. This is Dr. Ashwin Somarajan. Here is a case of 75-year-old female patient with a cataract of NS2 grade. And we can see the pupil is not much dilated even after the preoperative as well as intraoperative mydriatics. I thought of giving an attempt of making a rhexis with a cystotome without any iris hooks, and I was successful with it. I made a rhexis of around 5 millimeter. Here I'm making the entry and the hydrodissection, as well as I dial the nucleus properly. It's rotating, you can see. I thought of giving a try again with the phaco probe without any iris pupillary dilator like iris hooks. Here I'm doing the direct chop. Managed to chop the nucleus to some extent, but I realized that I have to take the small pieces into the AC and eat it, which is not really healthy for the endothelium, at least for the cornea. So I thought, let's make some space by inserting iris hooks. I made the incisions to insert the iris hook. This was actually, unfortunately, the first time I'm using this type of the type of iris hooks, right? We can see here, which is a little different from the ones which I used to use before. So I'm here struggling with the stopper, which was not moving at all. So I thought it's not very useful right now. I have to change the iris hooks what I am having in my stock. So I removed it. Then, as no other options was there, so I thought of going ahead with the surgery just like that. Somehow managed to chop it, the nucleus, bring it to the AC, eat it nicely. The iris was prolapsing from the wound, that is a side port. So I started using a spatula of a bigger gauge so that the iris prolapse was stopped, as well as was protecting the endothelium with the spatula to some extent. We can see almost all the pieces were cleared, filling the AC with the visco properly. With the bimanual, I thought of removing the epinucleus, which is pretty thick. I didn't attempt to clear it with the phaco probe, thinking that it would be much more of a difficult task and a way more riskier task that may lead to complications like PCR. So I managed to eat a little bit here and there, but again it was a struggle. So I thought of filling the chamber with viscoelastic nicely. Again, try it again with slowly with the same IA probe. At one point I realized there is some thick epinucleus, or a small piece of nucleus was still left. So I got my all-time favorite instrument. that is a Sinsky hook. So it brought that piece into the AC again, took the phaco probe, managed it, then attempted to pull out the epinucleus sheet which was there remaining, ate it with the phaco probe itself carefully. So once I felt everything was done, I inserted the intraocular lens in place, dialed the lens into the bag properly, again with the IA probe cleaned the whatever remaining cortical matter inside the bag. Ideally, this is not a proper way of doing surgery, but in certain situations where you are helpless, you have to go with your instincts and manage it accordingly. The patient had a very good outcome. Thank you.